Hello everyone. We're Team 11 and our project is about improving birth control options by reducing implant migration. A patient goes to their medical care provider to get their birth control arm implant removed, which is typically a quick and routine procedure, but when the doctor feels for the implant, it's nowhere to be found at the implantation site. After an x-ray, the birth control implant is nowhere to be found in the patient's arm at all, and after multiple more x-rays were taken of various parts of the patient's body, the implant was eventually found to have migrated from the patient's upper arm all the way into their lungs, as you can see in the image on the right. It's been found that 3 million U.S. patients choose arm implants as their primary form of contraception, with 0.26% of patients reporting implant migration and 0.02% of patients reporting lost implants altogether. Although at a glance these rates may seem small, this issue is extremely serious as migration can result in permanent nerve damage and life-threatening complications like pulmonary embolisms. These pulmonary embolisms may present themselves through severe chest pains or through no symptoms at all, giving patients little warning before disaster strikes. Additionally, to remove implants which have migrated into the lungs, endovascular retrieval is used and costs patients upwards of $14,000. As a result, there's a need to develop forearm birth control implants which do not move from the site of implantation.
Our team is proposing a redesigned implant with hooks that anchor the implant to connective tissue. The body of our implant is composed of a cylindrical rod made of ethylene vinyl acetate. EVA is biocompatible, non-resorbable, and has the elasticity and strength to withstand movement of the arm. What makes our design unique are the retractable hooks made from polyurethane, a thermoresponsive shape memory polymer. At hot temperatures of 110 degrees Fahrenheit, the implant is soft and the surface is smooth. However, after insertion, the polyurethane responds to body temperature by changing its shape into hooks. The implant will be manufactured by extruding rods of melted EVA solution containing barium sulfate for radiology detection and the synthetic birth control hormone etinogestrel. While extruded rods are still molten, hooks are inserted into the implant. Then the device is cooled and sterilized with ethylene oxide. The implant is inserted by a heated applicator in the upper arm of the non-dominant hand. After implantation, etinogestrel is eluted from the pores of the implant at a slow and controlled rate of about 30 micrograms per day. Then during removal, a heating pad is used on the arm to soften the implant and retract the hooks. An incision is made in the arm and the implant is removed with forceps.
In 2010, the Affordable Care Act made it so insurance companies are required to pay for all FDA-approved birth control. Insurance companies would also be responsible for the cost of the several x-rays and other medical procedures needed to locate and remove the implant after migration. If a patient does not have insurance, they will be required to cover the cost of the birth control as well as post-migration investigation and surgeries. Current subdermal birth control options cost $1,030.64. Our device would cost slightly higher as we have a very similar device with the added cost of the cost-effective shape memory polymer hooks. One x-ray can cost around $60 to $260, so with several images happening, this total can add up quickly. Reducing migration with our implant not only reduces the financial burdens on insurance companies and individuals, but it will also reduce the risk of injury for the patient. Although we may reduce some physical side effects of having a birth control implant, our implant will be a hormonal releasing material, which will still cause hormonal side effects.
Some of the many other forms of birth control include IUDs and oral birth control pills. Some IUDs include Paragard, as seen on the right corner of the slide, and Mirena, which is manufactured by Bayer. Oral birth control products include Yasmin, the more generic brand, as well as Bayes. With oral birth control pills, they must be taken at a consistent time every single day without fail, making oral contraceptives a daily task. As a result, 10% of U.S. women opt to use a form of contraceptives like IUDs and birth control implants. However, the IUD insertion process is very invasive, and many patients are simply not comfortable with the necessary implantation procedures. At the moment, the only other birth control that goes under the skin in the arm in the US is Nexplanon, which, as stated before, has a 0.26% of their patients with migration of their implant, including a few which had gone into the pulmonary artery. With the anchorage design of our project, these numbers can be lower as our anchored smart polymer design allows the implant to not migrate or get lost, but also be easier for the removal process as the smart polymer hooks can fold in.
Thank you for listening to our proposal on a redesigned birth control arm implant.